14 medical signs and symptoms never to ignore. It's normal to occasionally feel unwell. Symptoms like a runny nose, an upset stomach, or a headache are frequent. But what happens if your upset stomach won't calm down, or you really can't shake that headache? Some injuries and illnesses should be assessed and treated in a relatively short amount of time, frequently the sooner, the better. These warning signs are your body's way of informing you that it's time for a checkup. Is it a sign or symptom? A sign in the medical field is something that is visible to others. For instance, a rash could signify a skin issue, whereas high blood sugar could mean diabetes. Others can notice it or quantify it, including your doctor and relatives. On the other hand, symptoms cannot be seen or measured and are only visible to the individual experiencing them. Tinnitus may cause a ringing in the ears, but no one else can hear it. When something is wrong with your body, symptoms will show you. It might be a disease, an injury, or a health issue. See your doctor right away if you frequently experience any of these typical symptoms, since they could indicate that your body is coping with a more serious issue. Get it checked out if something doesn't seem quite right, because you are the expert on your body. This video is for you if you've ever dismissed warning signals or symptoms in the hope that they would go away. 1. Rapid weight loss. Having extra pounds melt off without even trying sounds like a Dieter's dream come true. However, this can be a signal that something is going wrong in your body. If you rapidly lose 10 or more pounds for no apparent reason, no dietary change or new exercise program, your doctor needs to evaluate why. It could be a sign of physical or mental illness, such as depression, if it is accompanied by feelings of sadness or fatigue. And an overactive thyroid, liver disease, diabetes, inflammatory bowel diseases, or cancer can also cause you to lose weight rapidly. 2. Fatigue. Many of us are busy and stressed, and may be exhausted due to everyday life concerns. But if you have bone-deep fatigue that seems different from normal tiredness, and doesn't get better even when you get enough sleep at night, this is a health warning sign that you need to discuss with your doctor. Fatigue can signal many serious problems, including anemia, diabetes, depression, sleep apnea, chronic fatigue syndrome, kidney disease. 3. Shortness of breath. Being short of breath after exercise, or because you have a stuffy nose, is considered normal. However, if you seem to be relaxed and you find yourself struggling for air, it could be a cause for concern. If you find yourself wheezing, making a high-pitched sound like a whistle when you breathe, or the breathlessness worsens when you recline, it's time to see the doctor. Chronic obstructive pulmonary disease, chronic bronchitis, asthma, heart problems, anxiety, panic attacks, a blood clot in the lung, pulmonary embolism, pulmonary fibrosis, and pulmonary hypertension are some of the culprits for this condition. 4. Intense headaches. While headaches are common in some individuals, any sudden onset of an intense headache, the worst headache of your life, or headaches accompanied by other neurological symptoms, weakness on one side, confusion, or seizures, are reasons to seek immediate medical attention. Severe, sudden headaches could indicate a stroke, aneurysm, or head injury. 5. Allergic reactions/anaphylaxis. A severe allergic reaction is known as anaphylaxis and can include symptoms of swelling, hives, a drop in blood pressure, or sometimes what is known as shock. It is the body's reaction to an allergic substance, such as a bee sting or peanut. This life-threatening condition requires immediate medical attention. 6. Feeling full after eating very little. If you haven't eaten very much, but feel full, consult with your doctor. You should also be concerned if you have nausea or vomiting that lasts more than a week. Possible conditions that could explain these symptoms are gastrointestinal disorders, pancreatic cancer, stomach cancer, and ovarian cancer. 7. Unusual bleeding. We need blood to survive. But there are some places you should never see blood. If you do, it should be taken seriously. Call your doctor immediately if you experience blood in your urine or stools, or are coughing or vomiting blood. Blood in the urine may indicate any number of conditions, including bladder cancer, kidney disease, urinary tract infection, injury, or anemia. Blood in the stools could indicate trauma or hemorrhoids, or something more serious such as colon cancer, diverticulitis, or inflammatory bowel disease. Vomiting blood could indicate an ulcer or a tear in the esophagus, esophageal perforation, while coughing blood could be associated with lung cancer. 8. Sores or wounds that won't heal. Whenever you have a sore or wound on your skin that does not heal within 3 months, or continuously reappears, it's time to see your doctor. This could be an indication of an infection, cancer, or diabetes and needs to be investigated further. 9. Swelling of the legs without injury. Sometimes our legs and feet can swell because of too much sitting or standing, or even from being overweight. But there are other causes as well, including heart disease, vein issues, or kidney problems. If you are experiencing swelling in your legs, seek medical attention as it could be the symptom of something serious. 10. Fever. Fever, or an elevated body temperature, is the body's way of reacting to infection. An elevated body temperature that is either above 103 degrees Fahrenheit or a lower grade fever that lasts for more than 7 days or keeps coming back requires medical attention. 11. Severe dizziness. There are many reasons you may feel dizzy. Some are more serious than others. Causes of dizziness include infection, vertigo, medication reactions, dehydration, and more. If you are experiencing severe dizziness, or you feel dizzy and are experiencing other symptoms such as high fever, numbness or weakness, chest pain, vomiting, or stiff neck, be sure to seek medical attention immediately. 12. Abdominal pain. See your doctor if you have severe or persistent abdominal pain, which can indicate serious health problems, such as appendicitis, intestinal blockage, gallstones, and a host of other conditions. Other warning signs that mean it's time to see the doctor include diarrhea lasting more than 3 days, black, tarry stools, blood in your stool, and heartburn that persists or worsens, even after you take medication for it. 13. Feeling like there is no point. Depression is very common, affecting 1 in 10 Americans. Left untreated, it can cause a downward spiral of worsening mood that can be hard to pull yourself out of. Symptoms include feelings of hopelessness or helplessness, self-loathing, loss of motivation or interest for activities that you once loved doing, appetite or weight changes, sleep disturbances, feeling tired all the time, and reckless behavior. If you ever feel like there is no light at the end of the tunnel, and death feels like the easiest end to your pain, help is just a phone call away. They're available 24/7 with skilled, trained counselors ready to help you find a reason for living. 14. Changes to the breast or nipples. Changes in the breast, such as lumps or a feeling of firmness, should always be brought to the attention of your doctor as soon as possible. Also, if the skin on your breast has dimples or redness, appears scaly, or is itchy, contact your doctor as these could all be signs of breast cancer. The sooner breast cancer is identified, the better chance for a positive outcome. If you are experiencing nipple discharge, you should also report this to your doctor as it could be related to several conditions that require treatment, including cancer, mastitis, and more. Act now, don't wait. Everyone gets sick occasionally, even if nobody wants to. All of these symptoms have one thing in common: acting early dramatically improves your chances of survival. Some things simply cannot wait till the following day or week. Visit a doctor right away. On the other hand, some of these symptoms might be experienced without any underlying cause of concern. You must therefore be familiar with your body in order to notice when something is off or just doesn't feel right. Talk to your doctor and explain how you're feeling. Don't ignore changes, no matter how subtle they may seem. Your body is telling you something is wrong. Listen to it. I hope you found this video to be informative and that you will eventually use what you learned to better your overall health. If so, kindly let us know in the comments section below. Additionally, please like and subscribe if you wish to support the channel. It would be greatly appreciated. Thank you so much for staying with me through the very end.